Yeah, the advantage of being able to show a patient a three-dimensional image of their tooth and what's going to be required in their treatment is that the things that we have to do as specialists are usually treat curved canals or canals that are placed in different locations than they're normally found. And being able to look at a three-dimensional picture of that tooth, they're able to understand where curves are happening and why the case becomes so difficult. One of the principal causes of root canal failures is missed canal space. In a two-dimensional x-ray, because of the superimposition of canals, you can't always see if there was canal space that was missed. But if you're looking at a cone beam image of that tooth, you can look at it in 3 dimensions so that if there is a fractured instrument or there is particular problem with a missed canal, we can actually look inside the tooth and see which canal was missed or which canal has that fractured instrument. So not only does it make it so that you can diagnose better, but you can actually increase the likelihood that treatment will be successful. One great example is a patient that came in, had vague symptoms of an infection, but couldn't be found on a conventional x-ray. In this particular case, it was a necrotic tooth that had started to abscess, but the abscess was hiding behind the tooth. And so during a conventional x-ray, it gets hidden behind the tooth because of its inability to filter out the tooth structure itself. Once we take the cone beam image on her and we're able to look through the image at different planes and at different angles, it becomes really easy to see what the problem is, why it's happening, and also really easy to fix. This patient presented with a complete history of initial root canal therapy, retreatment, and then surgical root canal therapy. But once we took the cone beam image, we could see that the cause of the patient's symptoms was actually that a post had been placed outside of the tooth, and that was causing a persistent abscess. In 2D x-ray, the post appears to be within the tooth structure. But once a cone beam image is taken and we can look at the tooth from the side view, we can see that the post is actually going outside the tooth and into the patient's bone, and that becomes a site for the abscess. In the same amount of time to capture just a single two-dimensional x-ray, we have what would be the equivalent of thousands of x-rays and from any angle that we can imagine, so that we can then use those thousands of x-rays to look at the teeth and the structures around the teeth from any angle and to be able to treatment plan accordingly. The difference in being able to see a tooth in 3 dimensions not only helps me as an endodontist to be able to treat the tooth, but when I'm showing a patient their tooth in 3 dimensions, it's so much easier for them to visualize what's going on. If you were an auto mechanic and you had to repair a part, you get to take that part out of the car and look at it in 3 dimensions and work with it. That's more like the experience you get with a 3-dimensional picture. You're able to see the shape and size and the configuration of the tooth. It's as close as you can get to extracting the tooth and being able to measure it and hold it in your hands and see what needs to be done to fix it. And that makes it so much more easy for patients to understand what a root canal is and what it is that we're trying to accomplish.